Okay, so the first thing, what makes you qualified to participate in this interview?
Well, I've been a musician all my life, and I have a degree in music therapy, and I've used music as part of my profession for 25 years.
That's a pretty good reason. From your experiences, how has music affected patients that have a hard time concentrating, and how does it improve their productivity?
Well, music works in so many areas of the brain simultaneously that it's kind of like a unification. Like it, I've seen it organize the thoughts of people who have dementia. I've seen it organize the cognitive abilities of people who have schizophrenia and other psychoses. I've seen people completely transformed by music into a more rational person. And I've also seen music assist in the educational process because of its organization of the brain and being able to retrieve the knowledge again.
Okay, so um, when you're talking about you were talking about different disabilities. What about memory retention? How does music affect memory retention?
Well, it 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 affects retention in that it helps retrieval.
Mm-hmm.
In other words, your brain has a series of like recipe boxes in it, but you have to have kind of like the key to open the box. And a lot of people that I've worked with over the years struggle with that. They struggle with what's called long-term retrieval.
Mm-hmm.
And so music assists because it's attached with a music association. If you attach learning and memory to music, most people, for example, who can't remember who they are or who you are, but they remember the song that their mom sang to them when they're 5 years old, because that part of their brain isn't damaged, because of that connection, that musical connection, they're able to retrieve the information.
So, especially since you have a mother that suffers from Alzheimer's, how would you say you've suggested her to continue playing music and as much as she can and surrounding herself with music? Why? Because of the memory retrieval.
Also, that also, but there's such a thing as what's called neuroplasticity,
Mm-hmm.
which means we neurologists and psychologists and always believed in the past that your IQ was your IQ. You know, you are what you are. You know, intelligence wise or cognitive ability wise. But that's not necessarily true. Research shows that there's such a thing as neuroplasticity, which means that your brain can change. You can augment your brain. In fact, for many years, people wanted to study these nuns in Mankato, Minnesota, which is near where I grew up, who lived extraordinary lives, extraordinary long lives, and none of them ever had dementia of any kind, Alzheimer's of any kind. And they wanted to know why that was. Well, finally, they got consent post mortem to study those nuns' brains.
Mm-hmm.
And what they found out is many of those nuns should have had Alzheimer's dementia.
Mm-hmm.
They had the lesions in the brain that cause Alzheimer's disease, but they didn't have Alzheimer's disease. Why is that? Well, because there's such a thing as neuroplasticity. Your brain works its way, can work its way around those lesions. So then the question became, why did their brains work around the lesions
Mm-hmm.
when others' brains don't? What was it about their lives that was different? Well, what was different about those nuns was they constantly were learning. Even in their 80s or 90s, they were learning new languages. They were learning to play musical instruments. They were practicing the use of more music. And what's come now in research is the two main contributors to intelligence or neuroplasticity are language and music. The two biggest ways to expand, to change, to modify your brain is to learn a new language or to play a musical instrument, especially the piano being the biggest, but string instruments, piano, not as much singing as playing a musical instrument. The act of learning that and the way that it works in your brain in so many ways, in so many areas of your brain, coordinating muscle groups, concentration, all those things work together to exercise your brain like a muscle. And you can make your brain overcome.
All right, now we're going to change it up a little bit and to something you're probably extremely familiar with, being a psychiatrist, musical psychiatrist. How does music affect emotion in the listener or the player?
I'm not a psychiatrist. I'm not an MD. I'm a music therapist.
Therapist.
But say that again. How does music
How
what?
does music affect emotion in the listener or whoever's playing the instrument?
Well, it can affect emotion on a lot of different levels. Music has been found to have effects on your body chemistry, from your galvanic skin response to the electric responses in your body to your heart rate and blood pressure. So it can have that effect. Emotional. It can have the secondary emotional effect based on the effect it has on you physiologically. Okay, that can cause you to become relaxed, emotionally calming your emotions, or it can have the opposite effect of firing you up emotionally, and you can have the secondary effect of firing up emotionally from the physiological things, or vice versa. However, there's a very powerful part of music in its connection to emotion and to that area of the brain because of association. We have different kinds of music that we prefer for whatever reason, and many times it's because of the association we have with that music. For example, it may be the song that your mother sang to you when you're a child, and you have a wonderful association with that music. And maybe that's country music, and maybe you grew up, and so country music always has that positive association with you. Maybe you have a negative association with music. Maybe you always did drugs while listening to death metal. So now every time that you listen to death metal, you have a response. You have an emotional response. You have a physiological response. You desire drugs. It brings about this association in your brain that brings along with it a lot of other things. Sometimes they're good things, and sometimes they're troubling things. So it becomes a job of a person like a music therapist to help you find the positive associations to help yourself, or reprogram the negative associations that hinder yourself.
All right, and lastly, how does physically playing an instrument affect the artist, and how does it interact with the brain? We touched on that earlier.
Well, a person who has been doing a lot of research in that area is the neurologist and musician himself, Oliver Sacks, who was made famous by the movie Awakenings, where he used music as well then, but he became so fascinated with it during that time that he decided to research that further. And he found a great connection between playing an instrument and concentration. For example, there's another part of this. There's a lot of research in this in a lot of different areas. One of them was actually done here in Galveston, Texas, at the University of Texas Medical Branch, where they have the Shriners Burned Hospital, and they have burn patients there. And they use music as a pain distractor during the tubbings, where they have to scrape the dead skin away, and it's a very painful process. But it was found that those people the music therapists work with needed far less pain medication. Also, Oliver Sacks worked with people who have Tourette's syndrome, and they found that people who had Tourette's did not tick while playing their instrument, that they were able to focus. The music assisted them, the musical instrument assisted their brain away from their tics and into the focus of the music. And in the same way, there's music-assisted labor and delivery, where music is used to the same purpose, to focus the patient, the mother, away from the pain of delivery into the music, where she can focus away from the pain. And it's been very effective. I know a couple of people who have used that form. And it's actually a pretty simple principle of focusing away, but music assists that because it works in so many areas of your brain.
All right. Thank you for your time. That was Steve Robson, father of Luke Robson. And, yeah, okay.